Good morning, everyone. I am Dr. Karunya Mannith. I am a general laparoscopic and bariatric surgeon from Apollo Spectra, Chennai. Today, I'm going to be discussing with you a very important topic. It's about obesity, its complications, what we can do about it, and when to take help. So, obesity, as we all know, is generally being overweight. It is just excess accumulation of fat in our body. It is measured roughly with an indicator called the body mass index or the BMI. It is a ratio between our weight in kilograms and height in meters squared. So, if your BMI falls between 18.5 to 24.5, it's healthy. Above which, up to 30 is termed as being overweight. From 30 to 35 is termed as class 1 obesity. From 35 to 40 is class 2 obesity. Beyond 40 is termed as class 3 obesity or severe or super obesity. So, what causes obesity? The general idea that most of us have, if we look at a person who's overweight or obese, is that they overeat, they don't exercise, they don't do any work, they're lazy, laid back, not too motivated. These are the terms we associate generally with a person who is overweight. But this is not it. There is so much more to it, that it's obesity is a very complex metabolic disorder, and it's actually not 100% a person's fault that they're obese or they overeat. So we have to go down and understand why it happens, so that we can it will help us to switch to a healthier lifestyle. So basically, it is a dysregulation of certain hormones which happen in our body due to variable causes which interact within themselves in our body and make our body store more fat than actually required. So, which also in turn makes the obese person crave for more calorie dense food, which results in weight gain. So let's just go discuss some of the causes of obesity. One is obviously we know hereditary. If our ancestors, our parents have been overweight in the past, we tend to carry the genes for that. So we are at more chance of being obese and to develop its complications also. Next is hormonal cause. It's very commonly seen among most of us and also missed. So certain common things are your hypothyroidism, these kind of things can also lead to obesity. And environmental factors. We should also remember that certain environmental factors can also trigger hormonal factors. They work together to lead to obesity. Environmental factors, for example, if we step out today out of our homes, how easy or rather difficult it is to find healthy food if you are traveling, or if you're on the move. It is very easy for us to get unhealthy food, junk food. It's always available, it's cheap, it's convenient, and it's obviously more tastier for us also because it's loaded with sugar and fat. So with our busy lifestyles and busy work schedules, we always opt for more convenient options. The supermarkets are filled with unhealthy options which are on deals and offers. So these kind of environmental factors also trigger and work along with other factors too, which lead to obesity in turn. And behavioral causes are associated with our emotions. We eat to celebrate, we eat to mourn, we eat for any occasion. So there has to be some kind of change in these small factors in our lifestyle, which will have a drastic change in the outcome, in the healthier outcome. So, what obesity can lead to? Obesity can lead, as if a person is just slightly overweight, they start to feel the brunt of it. They can't walk around easily. They start feeling breathless easily, and these kind of early changes need to be picked up. They have multiple joint pains because of osteoarthritis, knee pains, back pain. They can't get up and sit down easily. These kind of small mechanical effects of obesity are the first to occur. Then the social stigma associated with being obese is most of the time overlooked, but it is very important. Be at your workplace or at an education center, a obese person is always looked down upon a little bit. So it kind of makes them less productive at work, leads to certain psychological issues like anxiety, depression, which in turn can lead to further eating disorders like binge eating, which causes multiple failed attempts at weight loss. So it becomes a vicious cycle. Being obese itself can can make a person remain obese for the rest of the life if not if not taken seriously. So what are the other metabolic complications of obesity? It is like a package. If you're overweight, it's like buy one, get 10 diseases free along with it. So if you're obese, invariably you will end up with these complications at one point of time in your life if not kept in check. Number one is your famous type 2 diabetes mellitus. Along with it comes your systemic hypertension, then dyslipidemia, also known as your high cholesterol. All of this can in turn lead to your coronary vascular disease, which is just blockage in the arteries which supply blood to your heart. This can lead to heart attacks. These are the cardiovascular complications. Then your none of the organs are spared in obesity. Next is your lung respiratory compromise happens, breathlessness on exertion as your weight increases, and asthma is more common in obese patients, and the famous obstructive sleep apnea. Obstructive sleep apnea is nothing but the patient snores and struggles while sleeping. They have very disturbed sleep. They wake up multiple times during sleep. It's because of narrowed airways due to excessive adipose tissue along surrounding your upper airways. This is actually a silent killer, and most of the time it is taken as, oh, he's just snoring, he's tired, but that is not the case. You have to take it seriously and evaluate it more. And all of these complications put together can lead to their own set of complications like kidney failure, ending up in chronic renal failure, requiring dialysis. It can even go that severe. And women who are obese, it's not uncommon to see obese women suffering with PCOD and infertility. And obesity affects all your joints, can lead to osteoarthritis. And other more common one is your fatty liver, which you might see on your health checkup scans. Fatty liver grade 1, grade 2, grade 3 when you see is when you have to take alert. Okay, I have to take some serious steps, because fatty liver can further lead into cirrhosis and even liver failure at a later stage if not controlled. And obesity does not even spare cancers. There are certain types of cancers where the incidence is more in obese patients. For example, breast cancer, endometrial cancer, which is your uterine cancer, and colorectal cancers, liver, pancreas, kidney, urinary bladder, and prostate. So if you are obese, you are at higher chances of getting these other diseases also. So these are some of the common complications, and it's not that, okay, I am just a little bit overweight, all of this will not happen to me. So if you don't take steps at an earlier stage, invariably you will end up getting these metabolic complications if not kept in check. So moving on to what we can do to switch to a healthier lifestyle. So if you realize you're overweight or you fall into the obese category, uh, what are the things we can do by ourselves? So it's as simple as, calorie in, calorie out. That is what it was earlier. But let's start with the simple things: your eating habits and exercise. What are the small changes we can do with our eating habits? So first we look at the quality of food and timing of food. This is very important. Quality of food, if suppose a person is trying to lose weight, the diet that is suggested is a low carbohydrate and high protein diet. Generally, a person requires about 6 to 10 gram of carbohydrate per kilogram of body weight. So if suppose it's a 50 kilogram person, they require about 300 gram of carbohydrate in a day's meal. But if you're trying to lose weight, you have to reduce it to at least 3 to 5 gram per kilogram of body weight. For example, if like one cup or one regular katori that we generally use to serve rice is about 200 gram. So if you take 200 gram of rice, it contains about 56 to 60 gram of carbohydrate. So this is just a rough indicator. So if you are going to go on a low carb diet, it's maximum of 3 cups, that is half cups, 3 times you can take a day for to go on a low carbohydrate diet. So and just your rice or wheat is not the only source of carbohydrate. Even your fruits, vegetables, also they are complex carbs. They should also be considered. So overall, you have to kind of understand what goes into your plate every day and plan your meals. Moving on to protein, a high protein diet is recommended, especially when you're trying to lose weight. And Normal recommended protein per day is zero point 0.8 kilogram per body weight. Of course, it is more in children. It's about 1 to 1.2 gram per kilogram body weight. So your rich sources of protein are obviously your non-vegetarian sources are your egg, chicken, and fish, and vegetarian sources are your dals, lentils, legumes, and so on. So most of us know it, but we just don't inculcate in practicing it in our day-to-day lives. So make sure your plate is filled with less of carbohydrate, more of proteins, and more of raw food, raw fruits and vegetables, and less processed food. Give your body some work. If you go on to take refined, all refined and processed food which comes in packet, there is nothing for your body to digest. So your blood sugar just goes up immediately once you eat it. So go for whole food, whole grains which are not processed as much as possible. And moving on to timing of food. Timing of food is very important because our body is made in such a way by God has created it beautifully that we are made to work during the day and rest during the night. And so the hormones which are secreted in our body for digestion and everything is active during the day, starting from the time we wake up to about sunset. After that they slowly die down. So when we overwork our body by eating in the night, late nights, and binging in the nights, it puts our body in a completely hormonal dysregulated pattern, which leads to a lot of complications and in turn leads to obesity. So try to eat from sunrise to sunset, an hour from the time you wake up, and try to finish off all your meals, as early as possible. Keep your dinners light and early as possible. And this will really have a good outcome, whether you're trying to lose weight or just you're trying to shift to a healthier lifestyle. This is very important. And do not try to attempt any of the fad diets like lose weight in 7 days, lose weight in 2 weeks. All of this will show a reduced weight on your weighing scale, but it is not fat that you lose. Most of the time it's water and muscle breakdown which happens, and it's a very temporary weight loss, and this is not going to stay, and it is very unhealthy. You will only be becoming weaker and not actually healthier. Moving on to fat. Do you need fat in your diet? Is about 20 to 30% of your total calorie value should come from fat, and make sure it is coming from polyunsaturated and monounsaturated healthy fat, not your saturated fats. So when you buy something from outside, make it a habit to look at the food label, what it contains. So you will be more aware of what goes onto your plate and how to regulate the portion of that as well. And timing, as I'm always already mentioned, from sunrise to sunset, there are a lot of people who ask, is it okay if I skip breakfast? Not many people are worried about skipping dinner, but because dinner is, ironically, that is our heaviest meal of the day, but that it should be the other way around. Dinner should be light and breakfast is a must, because if you don't eat breakfast, a body starts using breaking down muscle instead of carbohydrate. So never skip breakfast. And moving on to, first we discussed about eating habits, then how do we expel the energy. So calorie in, next simple is calorie out. So about 60 to 70% of Indians spend their lifestyle, which is very sedentary, desk jobs, white collar jobs. So it is very essential we add some physical activity into a daily routine. Even if you're not able to go to a gym for an hour or so every day, that is okay. You can include regular some activity. Instead of taking the elevator, take the staircase. If you have to go to a close by shop, don't take your vehicle, take a walk. About just 20 to 30 minutes of some kind of physical activity, whichever you prefer, some floor exercises, walking, brisk walking, whatever it is going to help you. So do not neglect physical exercise. Even if you fall into the healthy weight category, do not neglect physical activity. Being inactive is very dangerous. So, and then make it a habit to wake up early. Your sleep is very important, minimum 8 hours of sleep, because reduced sleep will also increase your level of cortisol hormone, which again leads to weight gain and further a lot of complications. So reduce your screen time in the night before your bedtime at least an hour, because your blue screen, your mobile phones, your laptops kind of reduce the melatonin secretion in your body and delay sleep, and it causes disturbed sleep. They completely reduces screen time before you go to bed. Make sure you get a good night's sleep, wake up early, stress less over the routine mundane activities, because all of these in turn lead to obesity. They all work together and this cause your hormonal dysregulation and lead to obesity in the end. So, okay, I have followed a healthy diet. I am following a healthy diet. I exercise every day. In spite of that, I am not losing weight. I still crave all this unhealthy food. Then what do I do? So then that is where you need to take help. That is your nutritionist or your physician and the surgeon. Surgeon comes in the end when you've tried everything else. And so what physicians offer, for weight in your process to a weight loss journey. What we First you have the medicines for weight loss. There are certain few approved medicines which we give for weight loss, but these, of course, all the medicines come with certain side effects. We have to choose the correct patients for the medicine, and this cannot be given long term. And also we have to remember that none of these methods work alone. All of these work along with your lifestyle changes. So even if you're taking some medicines for weight loss and still you're binging and you've not changed your eating habits, it is not going to work. So along with medicines are given like a diet plan that we can give you with the exercise plan and the medicines can be taken maximum up to 6 months, and based on the progress, how you progress with your weight loss. And after medicines, we have certain endoscopic procedures, which, for example, we have the endoscopic intragastric balloon placement and the endoscopic gastroplasty. So the ultimate idea of these procedure is to reduce your stomach capacity so that you eat less. So the intragastric balloon, we place the balloon endoscopically into your stomach. It's a saline-filled balloon. This is also a temporary solution. It can be left in your stomach for about 6 months to 1 year, after which it has to be removed. So this also has to be combined with your lifestyle changes. It does not work alone. And your endoscopic sleeve gastroplasty is basically endoscopic procedure to suture one part of your stomach to reduce your stomach capacity in return. After your endoscopic procedures are your surgical procedures. So you may wonder, okay, do I need surgery? Should I go for surgery? Who are the patients who require surgery? The general idea is a person BMI above 40 is a good candidate for surgery, or a person whose BMI is above 37 with uncontrolled metabolic complications like diabetes, hypertension, where they are on multiple medicines and insulin and so on. So, what are the types of surgery? There are basically the idea of surgery is restrictive and malabsorptive. So, there's one technique like your laparoscopic sleeve gastrectomy where your stomach size is restricted by removing a part of it. Then there is the malabsorptive technique where a particular segment of your bowel is bypassed so that your food does not go there and it directly goes to the distal portion. So, this induces malabsorption, in turn leading to weight loss. So, and we have the combined techniques, which is the best recommended ones, where there is a component of restriction and malabsorption, which leads to weight loss and even resolution of metabolic disorders. So, if you fall into the overweight BMI or obese, or you face any of these complications, do not hesitate to take help. If you have failed diet, weight loss methods, and in case you need help even with your diet and exercise, do not hesitate to take help, because the problem with obesity is most of the time steps are not taken until the complications arise. If patient is just overweight, they don't do much to reduce weight until the complications arise, when they develop diabetes, when they have to be on multiple medicines. In the end, the prescription list goes on, but the cause is not treated. So take your weight as a priority and switch over to a healthier lifestyle. Just have some questions here. Does cardio workout give the best results? Okay. Cardio workout burns calories, that is true, but it is always best to combine cardio workout with strengthening exercises, because doing only cardio workout, eventually you're going to be burning up muscle. So, and one more thing you have to remember is, when you are working out or trying to lose weight, as I already mentioned with the eating, you need to take adequate protein. If you're going to exercise without adequate protein, you're going to be losing muscle. The weighing scale will show you're losing weight, but you will be actually becoming weaker with drooping shoulders and so on. So make sure your diet is good, and a cardio workout is good, but kept in moderation. It has to be combined with strengthening exercises. Only cardio is never good. So does dieting actually work? So as I just mentioned, fat diets do not work. They do not work at all, and they lead to a very unhealthy pattern in your eating style also, because these kind of diets, okay, lose weight in 15 days, have this soup diet, cabbage soup diet, all of these things, of course you will lose weight because you're not eating anything, but these are not diets which you can follow lifelong. So my advice is, stick to a eating pattern which you can follow lifelong. It has to be a healthier lifestyle rather than a diet which you plan to lose weight for, for a function or for a ceremony or something. Or I have to look, uh, slim or It doesn't work like that. So you have to follow a healthy, balanced diet which you can follow lifelong. And fat diets do not work in the long term. Sex can burn calories and lose weight. Of course, sex is a form of physical activity, and any physical activity you can burn calories with. So having a normal sexual life also does help in other, your general, where general health and mental status and everything. It is good to have your regular sexual life. How to lose kilos when you have limited time? Okay, this is what most of us face in our lives because of our work schedules and a busy lifestyle. Try to break up your exercise. You may not have time to go for an hour or two to the gym. Get up early in the morning and go for 1 hour thing. Even a 10-minute workout, 10-minute floor exercise will help. It has its own benefits. So as I already told, try to include certain activity in your routine. Like if you are going to office, if you're going to a shop, try to walk instead of taking a vehicle. Try to park your car a little further down and take a 15-minute walk whenever possible. Take the stairs instead of the elevator. Simple things that you can do in your routine lifestyle, which you can, will help you be more physically active. And of course, 10 minutes, 15 minutes a day, if we can't spare for our health right now, then when we have free time, when we get older, then that time you'll regret, oh, I should have done this earlier. So now is when 15 minutes, if we can't spend for ourselves a day, then I think our life is too busy. Drinking water helps lose weight. Okay. So good hydration is a must. Most it doesn't actually directly help losing weight, but what happens is, a lot of times hunger. I mean, your thirst is mistaken as hunger. You think you're hungry when you're actually thirsty. So make sure you're well hydrated all the time. Always drink water at frequent intervals. Keep a bottle with you and keep sipping on that, so that you don't become thirsty and drink water. So most of the time, in that case, along with your thing, you tend to snack or some in a way to increase your calorie intake. So drinking water doesn't directly help you lose weight, but good hydration is a must for a healthier lifestyle. How long before you start to weight again? I guessing this question means, after surgery, do you regain the weight? I'm assuming this is what it means. So usually after a metabolic surgery, weight gain is not uncommon. About 5 to 10 percentage of people can regain weight in about a 5 to 10 years period of time after the surgery. And most of the time, this weight gain is very less. It's only about 5% of their excessive weight loss. So they never go back to their previous, sorry, they never go back to their previous weight. So there might be weight gain if they don't follow their lifestyle changes and diet, and they kind of go off the track in between, but it never goes back to the earlier obese weight. Is avoiding carbs at night helpful? Definitely. Avoiding carbs is very helpful, as I already suggested. Low carb diet is the way to go, actually. And especially if you're trying to lose weight, and keeping low carb or even no carb dinner will really help you. Losing sleep gains weight, yes, definitely. As I already mentioned, at least 8 hours stress-free sleep we need, because less sleep leads to a lot of hormonal dysregulation in our body, which in turn makes our body store more fat. So these are some of the questions we got. So are there any more questions? So if you are struggling to lose weight and want to know more about weight loss methods, or any other doubts, you need any help with your weight loss journey, please feel free to contact us. We are here to help you at Apollo Spectra. Thank you.